And the second pair of pelvic movement is, we call it pelvic lift or pelvic hike or pelvic drop. This movement is becomes very significant when we try to side bend the spine. For example, when we're doing spinal movement, and this is our sideways bending, right? And then if I do this is my left side. If I try to hike my right pelvis, and it will become this. You see this movement? This is my right side, and I just lift my right pelvis, and then it goes into a deeper lengthening on my left side. Do you see that? So this is without the pelvic hike. I'm still lengthening my left side, and this is with the pelvic hike. And then you can see that when we do spinal movement, one leg spinal movement, when we do this, right? We lift the leg up, right? We attempt to do this movement, right? We bring the knee closer to the chest, right? We do this movement. But what is this movement? This is a hip adduction. This is hip adduction, right? From this position to this position, the legs actually come up further, which means it's doing this, right? It's a hip abduction. And this is really not helping us very much. But if I bring my knees closer to my chest by hiking my right hips, watch, it's this. You see this? The difference between this and this. In both cases, the knee comes closer to the chest. But the result is very different. One is just the hip movement. The other one is actually a pelvis movement that result in a deepening of the sideway bending. You can try yourself, right? So this is lengthening my right side, right? And then I begin to hike my left pelvis, and it's this. You see the movement? You see this movement? Right? And then this. And this is an exercise. We use this exercise to go deeper into a side bend, right? So we lift the leg up, and then we attempt to bring the knee closer to the chest. So this is a hip movement. This is pelvic movement. Hip movement. Pelvic movement. You see the difference? So try it, and then to see this movement. This. See, this is hiking the right hips. This is hiking the left hips. Right? It's basically a lift and a drop. A lift and a drop. Okay? And then try to see how it affect your sideway bending. Maybe we just do it like we did in the exercise. So now you lift the leg up. When you lift the leg up, it shouldn't be a result of just lifting the knees. This is a hip movement, right? When you go from here to this position, it should be a pelvis movement, right? And then you take the knees, you bring it closer bring the knee closer to the chest. It shouldn't be a hip movement. It should be a pelvic movement. Do you see the difference? The difference is huge.
I can feel the difference.
So try the other side. First time, just do it as a hip movement. So this is hips, right? And now do it as a pelvic movement. So that you're actually doing a hike with your left hip. Now it is very different, isn't it? And then take the knees. Again, first do it as a hip movement. And then do it as a pelvic movement. When you do a pelvic hike, this movement it also is associated with relaxation of the pelvic floor. Or if you try to relax the pelvic floor at the same time, it will make it a little bit easier. Actually, when you look at this pose, look. So when we are doing this position, when we are doing this, did you notice this actually looks like a yoga pose? Is it not a yoga pose? It's Parsvakonasana, isn't it? So what we actually did just then is actually an active form of Parsvakonasana done with the body in an upright position, which is in some ways easier because we are usually in this upright position. So we are used to we are used to this relationship with the gravity. But when we are actually in Parsvakonasana, we are no longer in this position, but we are in this position, right? So it's everything starts to feel different. That's why this pose is really not easy to do well. First of all, you want to be able to lengthen the spine, sideways lengthen the spine, as if we are doing this, right? So bring the shoulders higher, right? And then you bring the rib cage higher, because usually the rib cage is going sideways and upward. The hips are going sideways and upward, right? So we're actually trying to do the same thing. In this case, it's up and to my right, and the hip is up and to my right, right? And then now we have the front knee is supposed to bend. So here you understand why we are bending the front knee. This is what we did earlier. I'm bringing my knees closer to my chest. This is a hip movement. Now I'm going to bring in my knee closer to my chest by a pelvic movement. You see the difference? One is this. One is this. You see the difference? So the challenging here is really about the gravity. Because we are trying to sideways bending the spine when the trunk is being pulled by the gravity this way. So everything becomes different. This is why that you really will have to learn spinal movement, which you do actually in the upright position. You will know exactly what it means to come into this position actively. Otherwise, this will not happen. You see, this is not going to happen. And you will need to know exactly how to do a pelvic hike in this movement. Otherwise, this is not going to happen. It cannot. It simply cannot. You wouldn't know what to do. Right? So this is why I come to the conclusion that the spinal movement is the most important thing to teach. It's the foundation of all asanas. is foundation of all asanas. And I think the more you practice, the more you, I think to a certain extent, the more you teach, the more you will understand that this is the case.